Dispatch time is at 1523 H on the 19th of December, 2024. An emergency call reports a vehicular collision at Julia Vargas Corner, Ortigas Avenue, Pasig City, involving a motorcycle and a sedan. The motorcyclist, a 32-year-old male, is reported to have multiple injuries, including visible lacerations and suspected fractures. The EMS Batch 7 Group 5 of Metrovision has been dispatched to the scene to provide critical care. The driver of the sedan is unharmed and is cooperating with the authorities. Arrival on the scene time is 1530 H. The ambulance arrives to find the motorcyclist lying on the pavement, conscious but in visible pain. Significant bleeding is noted from his right thigh and arm. His right leg appears deformed, suggesting a possible fracture. Medic 10 Jaji, the team leader, confirms the scene is safe and coordinates with the Pasig City Police managing traffic control. Medic 5 Duran, the transport officer, parks the ambulance in a secure position and sets up reflective cones for additional safety. Hello, sir. My name is Jaji. We're here to help. Can you tell me your name? Groaning. Jake. Dela Cruz. Airway is clear. Jake is speaking without difficulty. Breathing. Slightly rapid, about 24 breaths per minute, but adequate. Circulation. Significant bleeding from a laceration on the right thigh. Capillary refill is delayed and his pulse is weak and fast, around 120 beats per minute. Blood pressure is 90/70 millimeters of mercury. Body temperature is 37.4 degrees Celsius. Glasgow coma scale of 15. All this information is being documented by Medic 9 Igualada in the patient care report. Hemorrhage control. Medic 6. ETAC applies direct pressure to the bleeding thigh. When the bleeding persists, he applies a tourniquet above the laceration to effectively control it. Medic 23. Servillijo cleans and dresses the laceration on Jake's right arm, ensuring it is properly bandaged to prevent infection. Immobilization. Medic 10. Jaji and Medic 5. Duran place a cervical collar on Jake to stabilize his neck and prevent potential spinal injuries. Medic 23 Servillijo splints the deformed right leg to immobilize the suspected fracture, ensuring minimal movement during transport. Monitoring and reassurance. Medic 10. Jaji monitors Jake's vital signs, noting his blood pressure appears low, indicating early signs of shock. Medic 6, ETAC and Medic 9 Igualada reassure Jake, keeping him calm and explaining each step of the care being provided. Transport to hospital time is 1540 H. Using a scoop stretcher, the team carefully lifts Jake onto the ambulance stretcher, securing him with straps to ensure safety during transport. Medic 5. Duran contacts the medical city in Pasig to provide an advance report. A 32-year-old male motorcyclist with a thigh laceration controlled by a tourniquet, a possible femur fracture, and early signs of shock. Medic 9 Igualada administers oxygen to Jake via nasal cannula at 6 liters per minute. En route to Medical City, Medic 10. Jaji reassesses Jake's vital signs. Blood pressure 100/80 millimeters of mercury, pulse rate 100 beats per minute, respiratory rate of 20 breaths per minute, oxygen blood saturation of 98%, Glasgow coma scale of 15, and pain scale of 8 out of 10. Arrival to the hospital time is 1550 H. At the medical city in Pasig, Medic 9 Igualada gives a concise verbal report. Patient 32-year-old male involved in a motorcycle collision. Primary injuries: significant laceration to the right thigh, controlled with a tourniquet. Suspected right femur fracture, stabilized with a splint. Right arm laceration, dressed. Care provided: tourniquet application, wound dressing, cervical collar, splinting, oxygen treatment via nasal cannula of 6 liters per minute, and ongoing monitoring. Condition: conscious, signs of shock, stable for transfer to trauma team. Jake is transferred to the trauma team for further evaluation and treatment. The team debriefs about the response, cleans and restocks the ambulance, and prepares for the next call. Effective hemorrhage control and rapid stabilization ensured Jake's survival and prevented further complications. Clear communication with the medical city allowed the trauma team to prepare for immediate care. Hope you all enjoy the presentation of Batch 7 Group 5. Special thanks to Doc Justin Villaruz and Sir Juni Villaruz, Medic 10 Jaji Team Leader, Medic 5 Duran Transport Officer, Medic 6 ETAC, Medic 9 Igualada, and Medic 23 Cervillajo, the ambulance crews. It's vital to recognize the dedication and teamwork that go into every emergency response. From the initial call to the hospital handoff, each member plays a crucial role in saving lives. The swift actions and coordinated efforts of our medical professionals ensure that patients receive the best possible care, even in the most critical moments. Thank you for watching, stay safe, and always wear your best smell.